My name is Dr. Michelle McMacken. I'm Executive Director of Nutrition and Lifestyle Medicine at New York City Health and Hospitals. Our lifestyle medicine programs began actually back when I was just a regular primary care physician practicing in our health system, New York City Health and Hospitals. I had the great fortune of attending the American College of Lifestyle Medicine conference about 10 years into my practice. It completely changed the arc of my career. And I started really talking to my patients about their lives and their lifestyle habits in a way I never had before. I got hooked pretty quickly because two things. One was I felt so much more connected to my patients. I got to know them in a way that I hadn't before. And two, I saw them actually start to get healthier, which is something I honestly hadn't really seen in my practice before that. Just me enjoying the experience with patients. When along came an opportunity to study lifestyle medicine as part of a fellowship in our health system, as part of that, I was able to teach my colleagues about lifestyle medicine and especially a focus on nutrition. That got the whole energy going. It got people interested. So out of that was born our first pilot program at Bellevue Hospital, which is one of the 11 acute care facilities in our public healthcare system, New York City Health and Hospitals. We learned a few things. One is that although it was hard, yes, we were absolutely able to innovate. Number two, we realized that the demand among the general public and patients for this type of service was through the roof. This is something that people really want and that they're not getting in other places. And then the third thing that we saw was that when we looked at our clinical outcomes, we saw people's hemoglobin A1C, their blood sugar dropping. We saw their cholesterol dropping. We saw their blood pressure improving. We saw them losing weight if they were living with obesity. That made us so excited that this model has so much promise. This is really great. So then fast forward a few years later, when Eric Adams is the mayor of New York, we were very fortunate then to have the opportunity to scale that pilot program. We now have 7 lifestyle medicine programs across every borough of New York City. And these are programs that are accessible to every single New Yorker, regardless of their ability to pay. When it comes to scaling a lifestyle medicine program at the level that we've been doing it, I think it's really important to recognize that you need to be very persistent and you need to be very patient. That might sound obvious, but we are a very, very large healthcare system. And for change to happen, it takes a lot of different approval levels, a lot of conversations. And so I think it's important to recognize what is your long aim, make sure that you are confident in the change that you want to make and then just keep at it until the change happens. It is so incredibly rewarding to see our healthcare system embrace lifestyle medicine, especially one as large as ours. We've built up a lot of credibility in our healthcare system around it, and to see patients tell us how, with our support, they've literally been able to transform their lives.